Today I'm going to talk about the evaluation of sources on drug abuse. My name is Ashley Bird and I am a student at Richmond Community College. I'm going to talk about drug abuse in the United States, a rise in prescription drug abuse in the United States, and what drug abuse and addiction can do to the brain, and then some resources for drug abuse. U.S. leads the world in illegal drug use. The World Health Organization surveyed 54,000 adults in 17 different countries. The survey was conducted on legal and illegal drugs. Out of the 17 countries, U.S. had the highest level of marijuana and cocaine use. Marijuana was used more widely worldwide in the United States at 42.4% compared to New Zealand's 41.9%. We also had the highest tobacco use at 74%. There was a variety of questions asked to these surveyors, and researchers found gender and socioeconomic differences in both illegal and legal drug use. Some of the things they found out were that men were more likely to use illegal drugs than women. Single adults were more likely to use tobacco, marijuana, and cocaine. And adults with higher income were more likely to use both illegal and illegal drugs. Prescription drug abuse in the United States is on a rise. It has become a major public health problem in the United States, and the use of these non-medical prescription pain relievers is second to marijuana. To give you a little idea, ER visits jumped to 21% from 2004 to 2005. Well, that was a total of 108 million ER visits in 2005. The Partnership of a Drug-Free America surveyed and found that 11.3 million people ages 12 and older admitted to using these non-medical prescription drugs. People said they received them from family, friends, relatives, doctors, the internet. Internet shopping is bad for prescription drugs. There's 185 websites to buy prescription drugs from, and 9 out of the 10 sites do not require you to have a prescription. Doctor shopping is also a major source of drug abuse for prescription drugs. People just going from doctor to doctor telling them they're in pain and they just give them the prescription. Understanding drug abuse and its addiction. It is a complex disease. It's an addiction. It's chronic, often relapsing brain disease that causes compulsive drug seeking and use. These drugs contain chemicals that affect the brain's communication system. The brain changes that occur over time can be challenging to one person's self-control. The drugs disrupt the nerve cells in the brain. And it does this in 2 ways: by imitating the brain's chemical messengers and by overstimulating this reward circuit of the brain. There was a total cost of substance abuse in the United States. It exceeds over $6 billion a year for people who have overdosed or gotten sick or have had to go to the hospital. Drug abuse is a bad problem in the United States. And quitting can be very dangerous for the body. There's a lot of risk factors that come in play for drug addiction: your biology, your environment, your age, your development. And the brain's judgment and decision making and memory can be affected. Here's a little diagram that just shows how all these risk factors that come in play with drugs can lead to addiction. Your biology and your genes, they account for about half of a person's addiction. And the environment can be anything from your school, work, friends and family, your social, economic status. And development for adolescents is very can be very dangerous because their brains are still trying to develop at a young age, and taking drugs early can lead to addiction. The resources for drug abuse, every county or surrounding county has an AA group. It's not just for alcohol, it can be for drug abuse and addiction. There's a lot of sources on the internet to look for places in your community. The National Institution of Drug Abuse is a good place to start if you're looking for something for help. Any kind of outpatient program or hospital setting or a doctor's office can offer help for drug abuse. And then the schools do the DARE program for kids and teenagers, which is a good idea because that's where the problem actually starts, is at a young age. And that's it. Please record.